Welcome back to freshman year of Pain Management University. Today's topic is neck and back pain. Of all chronic pain conditions, neck and back pain are the most common. In fact, it is one of the 10 most common disease conditions that affect humans worldwide. There are so many reasons for this: occupation, posture, obesity, body height, and age, to name a few. However, at the end of the day, it comes down to standing on 2 feet. If you stand on 2 feet, yes, that's you, it is more likely than not that you will experience some form of neck or back pain. Let's take a deeper dive into this condition. Deep under your back lies the spine. The spine has 2 primary functions. First, it is your backbone, of course. It gives us shape and structure, and we'd be mush without it. Second, it's a protective covering to your spinal column. Think of it as the clothing for your spinal cord. Let's go through each of these independently and we can see how things can go wrong. The backbone is made up of multiple different vertebrae that are segmented. The segmented vertebrae allow us to move in all directions: bend, twist, raise, and reach. The top of the spine are the cervical vertebrae, the middle referred to as the thoracic vertebrae, and the lower referred to as the lumbar vertebrae. Most of us have 7 cervical, 12 thoracic, and 5 lumbar vertebrae, though there are rare exceptions. In between these vertebrae are cushioned discs. They're much like a hardened jelly donut, yum, and serve as shock absorbers. These vertebrae all sit on a fused structure at the base called the sacrum. Think of the spine much like you would think of a house. The sacrum is like the concrete foundation, with the vertebrae as the framework that lies above. Now, remember the second function of the spine? It protects the spinal cord and its nerves. Through each vertebrae of the spine exits small nerves that come off the spinal cord. The spine is generally fully mature by the age of 18 for most people. Thereafter, there is no growth. Imagine fitting into the clothes you wore when you were a teenager. It probably wouldn't fit, right? Now you can see why these nerves are easily irritated from spinal breakdown. Each spinal nerve is destined to travel down a different path depending on where it comes from. For example, the nerves that exit the 5th lumbar vertebrae, called L5, head down to your hip, down your glute, across your outer thigh and leg, and into your foot. Similarly, nerves from your 7th cervical vertebrae exit the spine and travel to your shoulders, down the arm, and into your fingers. Remember, all nerves are like electrical circuitry. If your kitchen circuit goes down, you may experience a loss in function of your microwave, toaster oven, and blender. Similarly, an irritated spinal nerve can cause pain all along its path. That's why back pain is often affiliated with hip and leg pain. Cervical spine breakdown can lead to shoulder and arm pain. Now that we understand this, let's go through a few basic concepts. First, what is sciatica? Sciatica refers to the development of radiating pain that travels from your back and goes to your leg. It can be caused by a pinched nerve, joint degeneration, or even a muscle spasm. Long story short, it's a very generic term with many sources. Second, what can happen to those discs? Imagine a jelly donut that's squished from 2 sides. First, you'd imagine small cuts would form on the sides and the donut would expand. When that happens in the body, it's referred to as a disc bulge. If the jelly donut is squished hard enough and the jelly starts leaking out, we call that a disc herniation. Disc breakdown is a normal part of living life. However, it has the possibility of causing pain. The disc itself can be a source of deep low back pain. Furthermore, if the disc pushes far enough, it can irritate those delicate spinal nerves and cause nerve pain. Third, what is stenosis? Stenosis means that the protective clothing around the spinal nerves no longer fit well. The spinal nerves are too tight. Imagine you shrunk your shirt in the dryer. Happens way too often. Spinal breakdown causes tightness around nerves, or stenosis, as we say. When a doctor approaches a patient with neck or back pain, the goal is always to determine the root source. If we have a problem at hand, we have to nip the problem at the bud. There are 3 sources of chronic neck and back pain. First, there is a mechanical source of pain. Much like the previous examples, this suggests that something is pushing something else. If something pushes you, ow, that hurts. Well, if a disc pushes on the nerve will hurt. To determine a mechanical source of pain, doctors will often review X-rays and CT scans. This will show the bones. An MRI is more detailed and can show the discs, nerves, joints, and the relationships. Second, there is an inflammatory pain. If someone pushes you, you will also be angry. Similarly, if a disc pushes a nerve, it will get irritated and inflamed. Inflammatory pain tends to worsen with overactivity or immobility. Yes, that's right. You can hurt even more when you sleep. Remember our famous words, motion is lotion. Finally, if pain is allowed to be persistent for months or years, there can be neuropathic pain. If someone pushes you over and over again, you'd imagine that you would have a few bruises or scratches. Even if that person backs down, you may still hurt from your injury. Similarly, the nerve can be chronically injured from repetitive stress and impingement. Treatment programs for pain really depend on where along this pathway one's pain lies. For mechanical pain, the goal is to free the nerve from its mechanical stress. Options like physical therapy, chiropractic therapy, home exercise, and mobility training are suggested. Lifestyle and dietary modification are also essential. If severe nerve impingement is noted and a patient demonstrates signs of nerve damage, we may consider to surgically relieve the affected space. For inflammatory pain, we often prescribe medications to reduce inflammation. Interventional pain treatments are also suggested to reduce inflammatory debris. These options are not curative, but often help your body to heal itself. Imagine a burning building on a crowded street. The firefighters need to get there but may struggle in doing so if the entire neighborhood is out front watching. In this analogy, the inflammation is like the neighborhood and the firefighters are your body's healing cells. If we clear out the neighbors, the firefighters can do their job. Controlling the inflammation may help you with your home exercise regimen and mechanical pain. For neuropathic pain, we're generally limited to medications that help control and relax irritated nerves. Spinal cord stimulation may also present another option to speak directly to the nerves and help correct overactivity of injured nerves. For these more advanced options for pain control, please refer to the dedicated videos. When determining a plan of care for a patient in pain, we no longer prefer to take on pain one step at a time. After all, we want to go to war with your pain. Much like the military, we want to take on this enemy through land, air, and sea. The more help we get from different angles, the faster the results. In the pain management world, we call this multimodal analgesia. That means we will take on the mechanical, inflammatory, and neuropathic pain, often at the same time. Since everyone's pain is different, we may put together a different cocktail of options. We hope this is helpful along your journey to understanding, and please follow us along your specific pain pathway. As always, subscribe to our channel for more videos as you expand the frontiers of your knowledge. And remember, this is just freshman year. No video can replace the need for a formal medical consultation.